Hi, I'm Jay Norix, the developer of Parts and Memory Therapy. And this is my friend and volunteer patient, Kim.
Hello.
And this is our third live psychotherapy session with Kim, in which we're working on the excessive anger that she often shows during the PMS portion of her monthly cycle. We're trying to show that, and we will show, that psychotherapy alone can cure PMS. But for now, we're just working on the anger. And before we start, I want to ask Kim to catch us up on whether she's noticed any changes in the expression of her anger during her PMS cycle. And so, let me ask you, have you noticed any changes in just 2 anger sessions?
I have noticed a slight change, yes. I have noticed in dealing with my husband that there has been a slight change in my anger, and I am more aware of it.
Mm-hmm.
And
what is it that's different?
I recognize it faster, and so I deal with it easier. But very slightly.
Very slight.
Yes.
Okay. Any change in the duration of a given angry episode? Does it last, for example, is it shorter now?
It is shorter, yes.
How much would you say? Can you give it a number? What percent? 5%? 50%?
Not by much, but I would say by 5 to 10%.
Okay. All right. Well, we want to reduce it entirely so that it's minimal
Okay.
or absent during the PMS part of your menstrual cycle.
Okay.
Okay, then. Then what you said when you came in was, I don't know what I'm going to talk about.
Yes.
And I said, well, don't worry about it, because that's why we work with a part or subpersonality. And the angry part that we had found, you had earlier described as a slimmer, more muscular version of yourself, wearing a black workout clothes, black workout bra, and black tights, a bare midriff with a six-pack, very muscular.
Yes.
All right. So, since we've been working with her for 2 sessions, let's see if she has another memory that we need to heal.
Okay.
Can you find her?
Yes.
All right. Well, ask her how she's doing.
How are you doing? She says that she's feeling good.
She's feeling good.
Mm-hmm.
And would you ask her, please, if during your last PMS experience, you did tell me that you were just annoyed all day long with your husband. Would you ask her if that was her?
Was that you? She says no.
No. That's a surprise.
Yeah.
I thought we had only one angry part during PMS. So would you ask if she knows the part who was annoyed during your PMS episode?
Do you know who that was? She says yes.
Oh. And can you share that? Can she share that?
If she feels that it was her exorcist angry part.
Okay. Well, we had a little conversation about your exorcist actually earlier today.
Mm-hmm.
And you showed me a picture, since I had never seen the movie. I was too scared actually to see that movie.
Really?
So I never did. I've had many patients who I've had to treat who were so frightened by that movie that they needed therapy for the trauma of it. They saw it when they were something like a preteen. It can be very devastating.
Yes.
At any rate, I looked at the picture, and so I described her as very long, unkept hair, like it hadn't been washed in weeks, messy. She had either scars or bloody cuts on her face, or there was her forehead, or the bridge of her nose, and her cheeks. She just looked mean and ugly. Seemed to be wearing maybe a cotton nightgown.
Yes.
And so,
Yes.
since we can't work with who we thought was the angry part, let's see if we can work with the exorcist girl.
Okay.
You found her?
Yes.
Ah, all right. So ask her how she's doing.
She says she's doing just fine.
She's doing fine. Ask her if she's angry.
There's not so much right now,
All right.
but she can be.
Okay. And does the first angry part was one who told us she only came out during your PMS.
Mm-hmm.
Is that true also for the exorcist girl?
Yes.
She only comes out during your PMS?
Yes.
All right. And was it she who came out during your last PMS episode, who was angry with your husband all day?
He said yes.
Ah, all right. All right. Is she willing to let us work with some memories?
Said okay.
Then ask her to let her mind float back in time to the very earliest disturbing memory of any kind that she has. But just to be more specific, it doesn't have to be an angry or an annoying memory, but a way to float back is for her to focus on her memory of being annoyed all day with your husband. And she starts with that annoyed feeling, and then let her mind float back to the very earliest memory, disturbing memory of any kind that comes up.
Okay.
And what comes up?
What comes up is a neighborhood brawl where I get in a fight. I'm about 7 years old. Let's say between 5 and 7.
Uh-huh.
And I get in a fight with a girl across the street.
Uh-huh.
And it becomes a physical altercation.
Mm-hmm. And then what?
What happens is she says something to me that I do not like. I can't say what she says. I don't know I forget what she says. But I end up punching her in the face.
Wow.
Mm-hmm.
And then what happens?
And then she punches me back.
Uh-huh.
And then she pulls my hair. And then I pull her hair. And then we just keep fighting until we're broken up.
Okay. Anything that happens after that bothers you? Or is that the whole of it right there?
That's the hold of it.
Okay. So, can you visualize that 5 to 7 year old image of you who's stuck in that memory?
Yes.
All right. Then would like to work with those. So would you ask permission of the exorcist girl for us to work with that very young part of you?
She says fine.
Okay, good. Then let's go back. So we're working with that memory of the fight, and you can visualize yourself in the fight.
Mm-hmm.
So that image of you is what I call a stuck in time part. Sometimes I call it a stuck in the memory part.
Okay.
So what I'd like for you to do is to say hello to that little girl in your mind and ask her if she knows who you are.
Hello, do you know who I am? She says nope.
Then explain that you're a grown up and you've come back to help her.
I'm the grown up you, and I've come to help you. She says okay.
All right. So ask her what she feels about this fight that she had with the neighbor girl.
What do you feel about this fight? How are you doing? She says, she's trying to defend herself,
Mm-hmm.
but she doesn't know what she's angry about.
She doesn't know what?
She does not know what she's angry about.
Okay. Is the fight disturbing to her? Does it bother her that she had this fight and these feelings?
She says yes,
All right.
that this fight is disturbing her because she feels like she is hurting someone for no reason.
Okay. And what I'm looking for is the emotion that underlies the anger, because anger is always secondary. And so it sounds like right there is one disturbing, vulnerable emotion. She's hurting someone with no reason.
Mm-hmm.
So what would we call that? Guilt?
Yes.
All right. And so I don't know at a 5 to 7 year old whether she'd be able to judge how disturbing how much guilt she feels on a 0 to 10 scale. But maybe you could show her like this. If you look at me, we call this 0, and we'll call this 10, and this would be about a 5. 4, 3, 2, 1, 0. Ask her how much guilt she feels.
How much guilt do you feel? Is it this much, or this much, or this much?
That's your answer?
And she says that her answer is this much.
Okay, not a lot. Her anger is that much.
Yes.
But how much is her guilt?
Her guilt is this much.
All right. So that's a 4 or a 5.
Yes.
Let's call it a 5.
Okay.
We just need that number so we can test it against the results of our intervention. So would you ask her, please, if she would like to give up that guilt?
Would you like to give up that guilt? She says okay.
All right. And what kind of intervention would you like to use with her? Our last one, I think, you used vomiting into the toilet to get rid of the negative emotions. What would you like to use today?
Wind.
Wind.
Can we use wind?
All right. So shall I narrate a wind intervention?
Yes, please.
Okay. And ask her to just focus on where it is in her body that she feels the guilt. And then you guide what I'm narrating. You visualize it.
Okay.
So please visualize a powerful wind blowing over, around, and through the little girl, and so that it flaps her hair and it flaps her clothing and she can feel it taut against her skin. But she also feels it going right through her. And she feels that wind breaking up her guilt into tiny particles of dust and blowing that guilt away forever. So that as the wind blows away, it may be darker when it arrives because it's carrying away the guilt. Just keep the wind blowing until it's clear again. And now ask her, 0 to 10, how much guilt does she have? Let's use those hands.
She says that she has just this much guilt.
Just a 1?
Yes.
All right. I think you can probably take care of that with just a single blast.
Yeah.
A strong boom. Blow that right through her.
Okay.
Now, is that a 0?
It's at a 0.
Okay.
She is at a 0.
Now check on her anger. We want to find out if that working on the guilt also took her anger away.
She said yes.
All right. So when she thinks about the fight now, what other bad feelings does she have?
She doesn't anymore.
All right. Then tell her she did a good job. And thank her.
Okay.
And ask her what she wants to do now. Maybe go out and play.
Yeah. She wants to play right now.
Okay. Tell her have a good day. And then please go back to the freestanding angry part. The exorcist girl. Yeah. And thank her for working with us today and for letting us heal the little girl.
Okay. She doesn't speak English, she doesn't respond, doesn't communicate, so she just...
What do you mean she doesn't speak English? She speaks a different language?
She doesn't use words.
Oh, okay.
So instead she just uses her body language and she makes faces.
Alright.
So the face she makes when I say that is she just opens her mouth like, whatever.
Okay. So you interpret it as whatever.
Yes.
And when she gave us permission to work with the little girl, how did she communicate that?
She didn't respond at all.
Okay, you took that as to mean, yes, you have permission.
Yes.
Got it. Okay, well, it's good you know what she means. All right, excellent.
Thank you.
Anything to add today?
No, thank you so much.
All right. Then that concludes today's session. See you in our next one.